communities they're in to come up with plans. Some communities are going to realize the most important investment they need to do is add to the ability of their programs to provide housing. That's going to be the individual jurisdiction's decision. We all recognize that housing is an important medical intervention. And Ryan White, actually, the program I used to have in Baltimore before I became CDC director, I was lucky enough to have funding to provide housing for people, and it was critical for those people to benefit from treatment success. So I'm going to challenge the community again to basically, where that is the element that is the difference between success and failure for someone, then they need to include housing.
And I just want to say at a very high level, one of the Secretary's 4 priorities is value-based transformation. And what that really means is to start using money wisely. Saving money on an amputation for diabetes is not where you approach it. That money should be used for housing or food or education or nutrition or early care. So we're going to, the administration, you're not going to be aligned. We understand that there's a lot of differences, but value-based transformation is something that I think we all need to get beyond, we all get on board with, because it really is going to try to transfer some of the large medical system that used to pay people like me, an intensive care physician in a children's hospital or the state whom I work for, and allow that to be used more to the social determinants. So this is a big theme, and it's going to be something that's not only important in HIV, but something that I hope we can all get on board for the next couple of years to move that into the mainstream for all diseases, because it's really, sickle cell is one of my major issues, very, very important there as well.
So in terms of the community health centers, so I very much hear that. I think that in our initial part of this plan, because we have heard some of those concerns before, is that we are going to start by funding community health centers that are Ryan White Community Health Center co-funded initially. We're going to work on continuing to build cultural competence in community health centers as this program expands. If we really are able to, and we're going to be able to bring all these people into care, we are going to really need to have expanded our workforce in the places we're providing care. And community health centers make a lot of sense for that, but they have to be the place where people want to go, getting back to that question. A place that people feel comfortable and want to go. So we're going to start by being in a place where we are going to have some cultural competence already built into the context of the runway program, and leaders, people that are going to be champions of PrEP in the medical setting, and expand.